Well, good afternoon, everyone. I often thank the journalists for joining us at this press briefing, but I would like today to thank you, the public, for tuning in. Friday's briefing had almost 35,000 views across the various platforms. I know for some people this is becoming an important moment of the day. Thank you for your feedback about the people we have brought in to talk to you alongside our ministers. You have welcomed the doctors and nurses we have had, and I know that Co-op's Andy Corrie brought some welcome amusement to us all on Friday on the talk about the island's toilet needs. On a serious note, he did of course bring important reassurance about the supply of our island of food and essential supplies. We have heard your feedback and we will continue to bring members of our island community in to talk to you about what they are doing. I will hand over to the Health and Social Care Minister for his regular briefing on the current statistics. I have also asked David, or Ashy as I understand he is being affectionately referred to on social media, to update on questions that you are telling us are important around testing, including our frontline staff. David.
Thank you, Chief Minister. The number of positive confirmed tests now stands at 49. We have undertaken in total 1,061 tests and we're currently awaiting the results of 236. So that means that we have concluded 825 tests and there is also 109 tests to be sent away today. The total number of cases within hospital remains at 2. With one of those 2 hospital admissions now in ICU, but is currently stable and slowly recovering at this moment in time. One of the things I want to emphasise again is our age profile of our cases. Most of the world and other jurisdictions are seeing the age profile being of the older age range. That's not what we're actually seeing here in the Isle of Man. The age profile of the majority of our cases are in the age range 19 to 35. And so I think, again, it's very important to emphasise that that self-isolation and social distancing is just as important regardless of what age bracket you fall into. In terms of those awaiting test results, the 111 service now will text results, both positive and negative. So regardless of what your result is, you will receive a text from the 111 service giving you that result. I need to re-emphasise what I said at the briefing yesterday. The people who have been tested should continue to self-isolate until the test result is back, and they have been advised otherwise, as they may be asked to self-isolate further depending upon the result. So it is crucial that if people haven't heard things back, they don't just assume everything is fine and break the self-isolation. Also, in terms of testing, there has been questions around what we're doing in relation to frontline staff. The testing of our frontline staff, where appropriate, is an absolute priority for the department. Our on-island testing facility that we hope to have up and running in the next couple of weeks will make that an awful lot easier and speed up the process. And we are also looking at the antigen and antibody tests that are starting to come online now. But while we do look at that, it is important to emphasise that we are in a different position than the UK. The UK actually stopped community testing for a period and were only testing within the hospital environment. Here in the Isle of Man, we didn't do that. So while in the UK they lost track of community spread, and that people, even when they were showing symptoms, were simply told to self-isolate rather than be tested, we have actually continued with our community testing, which has meant our trace back has been an awful lot better, including with those that may be affected who are frontline staff as well. I can also tell you that we will be receiving on Ireland in the next few days 95,000 PPE items that are going to bolster our existing stock. Turning to pharmaceuticals, pharmacies are still delivering to the general public, and they should still be the point of contact for any delivery. Pharmacies are being supported for deliveries by St John Ambulance, but people for deliveries must contact their pharmacy in the usual way. St John Ambulance cannot act on requests direct from patients. That must come via their pharmacy. The other topic I have for you today is cancer surgery. In order to maximise our ICU capacity, and the current ICU capacity already being used, like the UK, we are moving to cancelling all elective and semi-urgent cancer surgery with immediate effect. Patients are being phoned by their clinical nurse specialist to advise of this change, and care plans are being discussed. This was an exceptionally difficult decision to make, and one that hasn't been taken lightly, but it is now essential that ICU has seen its first COVID patient admission, that we take this action, which we have held off doing for as long as possible. And also we need to repurpose theatres, except for the one for emergency surgery, including emergency cancer, as ICU capacity. We must do this now, as staff need to be retrained and changes made in the hospital. This action has been taken on firm clinical advice and consultation with our clinical base and also with public health, and we will be looking to support any cancer patients affected as best we can. Thank you, Chief Minister.
Well, thank you very much, David, for that update. Now, I've just come back from visiting our new Community Support Line Centre, and I'm really grateful to the team for the speed in which they've set up such an important resource for the island. The centre is staffed by civil servants from across government who have volunteered to be redeployed to work shifts to help their community. Now, David covered this yesterday in his briefing, but it is worth repeating that this is the number to call for all non-clinical questions relating to the current COVID-19 situation. The number to call is 686 262. You should be able to see it at the bottom of your screens. Let me say it again, 686 262. For medical needs, please continue to call our COVID 111 line, but this new 686 262 line is for anything else and will help to reduce waiting times for 111. The new line can help you with information on measures currently in place, support available in our community, support for businesses and workers, what to do if you are concerned about others breaching guidelines. It is also there as a resource for anyone who might not have access to the internet and our website at gov.im/coronavirus. If you know anyone who might have concerns or questions, let them know, please, about this number. I wanted to pick up on a few of the hot topics that the team at the Community Support Centre told me about. People have asked about various types of exercises and recreation. Can I go roller skating because the rules only said walking or running? Or how long can I go out for? Now, for things like this, I would call on everyone to use common sense. At the moment, we have not entered into the most precise detail because we want to be able to trust people to make the right decision. We all know what the measures are for. They are to prevent the spread of the virus from one household to another. It is about keeping yourself and your loved ones safe. It is about protecting the most vulnerable people on our island. It feels pretty clear to me. Please use common sense. Make the right decisions. If people abuse this flexibility, we will be forced to take additional measures. There was also a worrying question about employers forcing their employees to come into work and their workplace not practicing social distancing measures. This is unacceptable. If people can work from home, then employers should be enabling this. If they cannot, then social distancing in the workplace needs to be respected. If companies do not respect these rules, then we will be forced to take action. We have just made it through our first weekend, and I would like to pass on my personal thanks to all those who followed our rules. To those who had to work to keep essential services going, or those who were providing support for others across our community, thank you. To everyone who was able to stay at home, thank you. To those of you who have reduced any trips to the absolute essential, thank you. I know that our health and social care colleagues and our emergency services colleagues will join me in thanking you. This is how you can play your part and help them. I know that the current measures are tough for many, but we only need to look across to our friends in the United Kingdom to see the pressure they are under. It is clear that this is going to be a marathon, not a sprint. The UK do not believe they are at their peak yet. The tide is building there, but the wave has not yet crashed. The worst is yet to come for them. I want to finish with some positive points. Firstly, I would like to thank our island food retailers who have worked with government to put into place a system to identify supply workers, whether government or from registered private providers who are shopping for our most vulnerable. They may be shopping for multiple households. We and our retail partners wanted to avoid any confusion that they might be over shopping. They will be wearing high-vis vests. And this is what they will be wearing. They will also be carrying documents to confirm who they are. If you see these people, they are supporting our most vulnerable people. They deserve our respect and support. Secondly, you may have heard about the establishment of the Manx Solidarity Fund, or Solidarity Fund. As the Treasury Minister mentioned this morning, this is a new initiative established by members of our community and driven by some of our leading businesses to assist our most needy individuals, businesses and organisations. I thank all of those involved for their energy and community spirit. Thirdly, I wanted to thank all those public servants who have shown flexibility and are being redeployed to support frontline services. As well as those I saw this morning manning the community support line, redeployed civil servants are supporting the clinicians on the 111 line, supporting public health in their contact tracing, and colleagues from Isle of Man Transport who are now stewarding cars at the mobile testing centre. These are just a few examples, of course. There are many others. Department silos are breaking down as the whole public service has joined a concerted effort to support the island. Lastly, I know that there are so many people out there who are going the extra mile for our island. I would like to ensure that we recognise them in our briefings and social media. If you have seen someone who deserves a shout out, then please let me know through our social media channels using the hashtag Howard's Heroes. So thank you for everything you've done so far for our island. Please keep it up. Keep yourself well. Keep your families well. Keep your island well. Thank you. Now I'll take questions from the media. And I think first we have Tim, are you there from Manx Radio?
I am now. It's the first internet crash during a press conference I've had, so apologies, I've missed quite a bit of it. I know you've gone into, and I will be as quick as possible because I know a lot of people are mentioning this as now Howie time, and it means they can have a drink once the press conference is finished. That's how they're marking their day. But on the testing front, if somebody is tested positive and they've served their time, they're finding it difficult to get information then as to when they can go back to work, what they need to do, what the process is. Can I maybe just get your views and maybe the health ministers on that scenario?
Okay, Tim, I'll probably ask the health minister to do that. David, if you want to come in.
Good afternoon, Tim. In relation to this, basically, if someone's outstanding a test result and they've been showing symptoms, they must continue to self-isolate until that test result comes back. Once the test result comes back, then they will be advised onto what they need to do, because in some cases, they may be asked to self-isolate further. So the important thing is that if people haven't heard anything back, they don't assume everything's fine and they can just go about their ordinary business after the 14 days is up. It's absolutely crucial that people continue to self-isolate until they are advised otherwise.
This is somebody who has tested positive and they have done the 14 days, not from the test, but from when they first self-isolated. and they're really wanting us to get guidance on when they go, what they do in order to go back to work.
Well, in terms of that, my advice would be that they contact 111 and seek advice if they've already completed the 14 days while they've been waiting for the test result, or the test result has come towards the back end of the 14 days. Because like I say, in certain cases, the medical advice might be for them to self-isolate further. So if I was them, I'd actually contact the medical professionals and actually find out what they think about their individual case.
Thank you. And while you're there at the podium, David, can I ask about the 49, as it is now, positive cases? If that's 49 individual cases, or whether we know it's 49 that are, say, related to 22 households or different cases. Just some clarity on the cases that we have.
Yeah, at the moment we don't have that because literally the numbers have been ticking up as the day's been going on. So we have to do the back tracing to actually work that out to see if they're connected to other cases. Certain days I'm able to give you that information because we haven't had the new cases building up. Today's one of those days where we have had new cases building up, so I don't have that. Equally, the breakdown of which are travel related and which aren't, because there's some which public health still need to interview. So as soon as any day where I can give you that information, I will give it to you, but I won't be able to do that every day because it literally depends when the test results are coming back.
Thank you, David, and thank you, Chief Minister.
If I can just confirm on that one, there are obviously some families who have it. So we're not talking about 49 separate households where there will be a number of households where the entire family have caught it. But obviously when we can give you that sort of information, we will, of course, give you an update. So now if I come to Leanne from 3FM. Leanne.
Good afternoon, Chief Minister.
Hi, Leanne.
My first question is, what supports or measures are in place to protect the homeless on Ireland during the pandemic?
Well, obviously, social care have been working with the third sector on this to ensure that we are aware of what we're classifying as all the vulnerable on the Isle of Man. And we're asking all charities that work in these areas to contact social care. And there have been a number of days meetings where all the various charities have come together or via this sort of arrangement to discuss who is vulnerable out there and what can be done to make sure they're not forgotten and that a package is put in place to give them the support that they need. Because whilst we don't believe we have people physically sleeping rough on the streets, we do have people who sofa surf, for example, and they are counted as homeless. And you're quite right, we need to do everything we can to help those people. And we would ask again, whilst we've got people ringing in about family living in India at the moment, say, if you know of someone who is in that position, then please contact our social care department, part of health and social care, and they will take those details. So thank you very much for that, Liam.
And my second question is for the Health and Social Care Minister, please.
Okay, David.
Good afternoon, Leanne.
Hi, David. My question is, we've had quite a few queries of people concerned when they're doing their local shops, say at Tesco's, full of surfaces, whether that be shopping baskets or trolleys. So I'm just wondering if you could provide any clarity on how long coronavirus can survive on surfaces, or if it's transmitted via surfaces.
There's been various studies done around the world on this, and there's nothing firmly conclusive as yet that says this is the maximum period it can survive on surfaces. The average depends upon the type of surface. So, for instance, most of the studies worldwide have shown that metal is quite a large carrier and can hold it longer than other surfaces. So touching something that might be paper-based, like a carton or something like that, it actually lasts less time there than it does on metal surfaces. In terms of metal surfaces, that's why we've been working with the retailers for them cleaning down their trolleys. People who've been into Tesco's, people who've been into Marks and Spencer's or other outlets, ShopRite, will notice that staff are cleaning down the handles, they're cleaning down the surfaces, but there is no conclusive study yet that actually says the particular amount of time it can survive on surfaces. Again, I'm sorry to keep bringing up the word common sense, but a lot of it does evolve around common sense of what people are touching and people continuously cleaning their hands and the hand hygiene messages that we've been putting out. That's the absolutely fundamental point.
Thank you.
Can I just add in answer as a little additional one to that? If instead of people going every day shopping and causing further delay, we can try and do a weekly shop, then that's going to give our supermarkets the chance to get that extra cleaning in their stores, rather than have some of the horrendous queues where we've got maybe people going there every day. Try and plan your shopping, be considerate, so that we can free up time in the stores to have a clean or more often. So thank you for raising that one, really helpful. So now we move on to Paul Moulton at MTTV. Paul.
Hello, Mr. Quayle. The Territorial Army Reservists, is it true that they have been given letters here in the Isle of Man? They're being called up to be ready for service from the beginning of April? If so, is this an Isle of Man Territorial Army exercise, or are they going to be put to use? Do you know anything about that?
Yeah, well, obviously there are a number of people on the Isle of Man reservists that we may have to rely on. I think it's important to state that this isn't just about your government planning for what's going on at the moment. We have to plan for long-term solutions, and if the problems get severe, then we have to be prepared for that. So if we have, say, a significant outbreak amongst the police force, then we have to have people who can step in to help out. So all that's going on is that we are trying to plan for as much as possible. You can't think of everything, but it seems absolutely logical that we work with our reservists to ensure that if we need them, they're there to help. And that should be hopefully a sign of not a panic or anything in any way, shape or form, but as proper, sensible forward planning to make sure that we're ready.
And without giving away my second question, just a little bit on that, would they be given special powers? Will they be given like police powers or what?
Well, this is what we're working on at the moment. We have to make sure that they have whatever they need to help carry out the duties. But also it'll be there as a reassurance to help out should there be a significant problem. We like to think that we've done our absolute best to take the curve down on the coronavirus, but I think it would be irresponsible of any government if you didn't try and plan for some of the more serious situations. So you hope never have to use them, but at least you've thought it through and you're ready to go.
And could I speak to Mr. Ashford, please, for the second question?
Okay, David.
Good afternoon, Paul.
Hello, David. Have you got your stats there? Because I want to double check what you said. I believe you said there's 49 cases. That's fine. Then you said 1,061 tests, 239
Yes.
waiting, and so on. It's just that at 5 to 4, we get a press release with different numbers completely.
Yeah.
And I'm worried that they're saying there's been 825 concluded tests, 236 tests awaiting results, 182 people are waiting for tests. Why are these numbers different from what you say?
They're not. That's exactly the figures I gave you. Total concluded tests, 825. Awaiting results, 236. Total tests undertaken, 1,061. That's what I gave you at the start.
161 is the one that was confusing me then. And therefore, that wasn't a question, those two people in ICU, have they always been the same two people?
Right.
Are they different people?
Right, this is to show that I can actually sort of do things in real time. I see one of the things that's trending on this briefing is an argument over whether there's one or two in ICU. There are two hospital admissions that are COVID-19 patients confirmed. There is only one of those in ICU. So not both cases in ICU, only one of them is requiring ICU treatment.
You keep mentioning two people. Have they always been the same two people? I suppose that's
It's been the same two patients.
Thank you.
Thank you very much. Glad to clear up that those figures if people are getting concerned. So next we move on to Chris Kay from Energy. Chris.
Good afternoon, Chief Minister. As our closest neighbour and with many people working and visiting family and friends there, does the length of the travel restrictions in place very much depend on the severity of the situation in the UK?
Well, it depends on two factors. A, the spread on the Isle of Man and the curve, and it will take us a number of weeks, the 3-week period, to come up with the data that we need to see what is on the Isle of Man and how it's spreading. We're not seeing massive jumps, but we don't know what's around the corner, so we need to wait to look at our own figures, and that will take medics' advice. But equally, we also need to look at what's happening in the UK if we feel that it's under control, and it's safe to bring people back, then of course we will. But at this moment in time, the number one responsibility of myself and the Council of Ministers is to ensure that we look after all the people on the Isle of Man. So we will be taking the data from what's happening on the Isle of Man and looking at the UK.
And it's not the first time I've heard you say people should be able to work from home if they can. Does that mean you're aware of certain employers not cooperating with the government advice? And if so, how do you propose to clamp down on that?
Well, we've had a number of complaints which I'm having investigated. Now, obviously, some businesses, if you're in a manufacturing business, unless you're in the office, you're really going to struggle to work machinery from home. So there has to be a level of common sense. But equally, if you are working from a factory and there's a lot of you, then the 6 feet or 2 meters social distancing needs to be maintained. And if people are complaining that that's not happening, then we need to clearly look at this to see if that's the case and take action. And we have had a couple of complaints, and I have asked officers to investigate this.
Thank you.
Okay, thanks very much. Right, Alex from BBC.
Hello, Chief Minister.
Hi, Alex.
Just a question on, we've heard a lot of use of these terms, common sense, be sensible. Until these regulations come into place defining exactly what people can and can't do from their own homes, going out for exercise, etc., you must agree that this is largely academic. I think there's been a bit of confusion as to things like what counts as a necessary trip, what is the allowed amount of daily exercise. And I'm just wondering, who do you think those limits, in the absence of any regulation, should be up to? Should it be up to yourself? Should it be up to the Council of Ministers? Should it be up to police?
Well, it should be up to the people themselves for the time being to make that common sense judgment. Going out once a day for exercise, it doesn't mean to say you spend half the day out. That's clearly an abuse. Going to the shops or to get medicine, those are key journeys. Or going to work if you can't work from home, those are key journeys. But we're just asking people to have a little bit of common sense and not to abuse it. Now, if we get to a situation where we've got to prescribe that you can only go out for X minutes a day or hours a day, then that's getting pretty draconian. And all I'm asking people is to have a little bit of common sense in their approach to this. If government is having to come up with all sorts of rules and regulations on how long you can do this and how long you can do that for, then we're really going to tie down, A, our own officers' time, and B, the people of the Isle of Man will suffer from this. So the whole point of people using common sense is to avoid passing the virus between yourself and other families. That is absolutely key. So we're asking for common sense. People should be able to be reasonable about this. And as I said, instead of going out every day to do a shop, try and just go out and do your weekly shop once a week. It's in everyone's interests that we use common sense and go forward as a united Ireland. I do not want to have to be in the position where I'm coming back with a long list of what you can do and the times that you're allowed to do it in. But, worst case, we'll have to, but that's something I really, really want to avoid.
But it would appear that, judging by what police are putting out there on social media and what different members of the public are putting on social media, people's definitions of sensible and common sense do vary.
Well, it does, and that's why we've set up the helpline for if they have concerns, people can ring up the helpline to get advice on what is a fair time. If they're really, really concerned, then do ring up the helpline number that I've given. But we've got to be sensible about this. If government dictates times, that to me is the last resort, and I just hope people will act with common sense. But if they are concerned, then we've come up with a new number to ring. I think it's at the bottom of your screen. Ring that number and get the advice from the officers who are manning it.
Thank you very much.
Okay, right, and Isle of Man newspapers, Jess. Hello, Jess.
Good afternoon, Chief Minister.
Hi, Jess.
So we've heard of 2 island residents who are currently affected by the lockdown in Goa, South India. They say that there's a shortage of food there and that the general population is struggling to find the bare essentials. Is the Isle of Man government liaising with the UK Foreign Office to help these Manx citizens at least get to the UK?
Well, what I said in Tynwald, and it seemed to be misreported. I said clearly we don't know everyone who is off island, but if people who are off island and we don't know about or are having problems, then contact us, and that we will do our best to see what we can do to help them. So obviously, if we know that there are people struggling in far-flung places of the world where they physically, I know all the flights from India have been cancelled, so you can't get home at this moment in time. So if they cancel us, then our team will obviously be contacting the UK government, who we use their embassies. We do pay a contribution every year to the UK for Armed Forces, Embassy and the Coast Guard, and we would hope that the UK embassies out there get in contact with Manx residents to give advice and any support they can.
Okay. For my second question, you showed us the priority access vests to help social care workers shop more easily. In terms of key workers who are driving into work...
That's just gone off.
For instance, I saw on social media there was an incident. A farm had they had a ewe that was giving birth to twins, and they sent for a vet to come over, and they were stop checked allegedly, and this led to fatalities with the twin lambs being born. So I'm just wondering, is there anything being drafted up to kind of help key workers get to their point of call as soon as possible?
Well, I think it's reassuring that the police are doing checks just to ensure that people aren't abusing the travelling all over the island. Obviously, this was an isolated incident, and I would hope that once the police see that it's a vet, that they would let said vet move on pretty quick. Sorry, we've just lost you a little bit, but you're back now with us. But so what I'm saying is, again, common sense. The police obviously realise that vets have the right to get out and round the island as key workers.
I believe you're on mute, Chief Minister. I can't hear anything coming through.
Right. We're fine now, according to my team.
Yeah, I can hear you now.
Okay. So what I'm saying is that common sense, obviously the police were quite right to do these spot checks to make sure who's driving around and is it necessary. But obviously once they have ascertained that it's a vet going out to their duties, then the vets do have the right to go around the island, obviously following the rules and regulations on hand washing and the distancing from members of the public.
Okay. Thank you.
Thank you very much. So I think that's all questions. We've been through everyone today. Thank you all very much for coming. Thanks for listening. Stay safe. Thank you very much.